At the 2015 Conference on Retroviruses and Opportunistic Infections, Dr. Ronald Baldessari asked a number of colleagues to share their perspectives on the research being presented. Here is one perspective.
Hello, this is Dr. Ron Baldessari reporting from CROI 2015. There are a number of federal leaders attending this important scientific conference, and we've invited them to share their observations and perspectives about the science being presented here.
Hi, my name is Peter Kim. I'm a physician scientist at the NIH, and I'm here reporting from CROI in Seattle. Today I'd like to talk to you a little bit about TB and HIV and the reason why TB is being highlighted at this meeting. TB, as you may or may not know, is the leading cause of death among HIV-infected patients worldwide. In fact, 1/4 of all patients with HIV that die because of TB. Now in the United States, TB is not as much of a problem when we look at it epidemiologically. However, for clinicians and physicians taking care of HIV patients, we do continue to think of TB a lot. And in fact, when patients come into the emergency room and they're HIV infected and we suspect pneumonia, one of the first things we have to do is to rule out TB, just because it is such an infectious disease that can transmit infection through the air. TB is being increasingly transmitted from person to person in dangerous ways. So drug resistance has become an increasing problem, and in the past we used to think of drug-resistant TB as something that happened when people failed to take their TB drugs. However, we are now recognizing that increasingly drug-resistant TB and extensively drug-resistant TB is being spread from person to person in people that have never had TB before. And this is a really big concern. In fact, one study presented here at CROI showed that 80% of those with extensively drug-resistant TB, or XDR-TB, had TB for the first time, and it was transmitted through the air. The second thing we're taking away, though, is that the research that we're doing in TB is having a dramatic impact. New drugs are coming on board, and we are learning to use the new drugs better. Diagnostics for TB are significantly better because of the technologies that we're incorporating into these diagnostics. So very soon we will be able to diagnose TB in less than 2 hours with the sensitivity of the culture, which normally takes a week. The issue of TB in the United States is that despite the low numbers, it remains a serious concern. Unfortunately, even with the technologies and the level of healthcare we have in the United States, when it comes to extensively drug-resistant TB and multi-drug resistant TB, treatment still remains very difficult. So it is a serious problem. And lastly, when patients come into the emergency room, whether they have TB or not, it remains a serious concern because it is so easily spread from person to person when they are put together in the same room. So that takes up a lot of resources for a hospital to take care of patients. So the better job we do at diagnosing patients quickly and taking care of them and giving them optimum treatment will mean a big difference for patients in the United States as well as abroad.
For more information about the conference, visit www.croi2015.org. And for more information on federal HIV programs, visit AIDS.gov.